બિસ્મિલ્લાહિર્રહમાનિર્રહીમ. અસ્સલામુ અલૈકુમ. મુશ્તાક અલી એક વખત ફરી એમના પ્રોગ્રામમાં હાજર છે. જેમ કે લાસ્ટ વીક મેં કીધેલું ડાયાબિટીસ પર કે કેટલું જરૂરી છે કે આપણે આપણી હેલ્થનું ખ્યાલ રાખી અને ડાયાબિટીસ જેવી ઇલનેસ જે બહુ કોમન છે એ આપણે કોશિશ કરવી જોઈએ કે આપણને ન થાય, અને આપણને ડાયાબિટીસ હોય તો આપણે આપણા બ્લડ શુગરને કંટ્રોલ કરવું જરૂરી છે. હવે આ વખતે મને ઘણી રિક્વેસ્ટ આવી છે કે જે માણસો ગુજરાતી નથી સમજતા, તો એ લોકોની રિક્વેસ્ટ આવી છે કે હું આ વખતે એ જ પ્રોગ્રામ ઉર્દુમાં અને ઇંગ્લિશમાં કરું. તો આ વખતે મારા જે ભાઈ બહેનો ઇંગ્લિશ નથી સમજતા તો એ મને એક્સક્યુઝ કરજો, કારણ કે આ વખતે હું આપણા ભાઈ બહેનો જે ગુજરાતી નથી સમજતા તો એ લોકોના બેનિફિટ માટે હું આજનો પ્રોગ્રામ ઇંગ્લિશમાં કરીશ. For the benefit of my viewers who do not understand Gujarati, today I'm going to talk on diabetes and good health. Diabetes is a condition that causes high level of sugar stroke glucose, because sugar is glucose in our blood. Because our pancreas do not produce enough insulin to move glucose from the blood stream into the cells of our body for energy. If our body does not make enough insulin or cannot use the insulin it makes, which is also called insulin resistance, then sugar stays in the blood and cannot move into the cells to give energy to work properly. So in very simple words, when there is too much sugar in your blood and it's not transferred to the cells in your body, it stays in the blood, and there is a fine threshold, and if you exceed that threshold, if you go above that, then you are diagnosed as diabetic. Now, it is a very common illness, and people sometimes either take it very lightly or other people take it very seriously. So both the extremes, in my opinion, are incorrect. Now I must make this point very clear here that I'm not a medical doctor, or I do not specialize in any medical practice, but this is a field in which I'm very interested, because I'm myself a type 2 diabetic for over 20 years, and I have done a number of experiments with my diet, so on and so forth. We will come to that, and that is why I think and I consider that it's important that people should hear me out, and if I can benefit any of you out there who have diabetes, or who are on the borderline, or who have very chronic, very severe type of diabetic, I think this program will help you. In UK alone, 4.7 million people are diabetic. 4.7 million people. On top of that, there are 12.3 million people who are at increased risk of type 2 diabetes. Worldwide, more than 371 million people have diabetes. Now these are very high figures, and in everyday life we see that people do say that my sugar level is high, my sugar level is on the borderline, but it doesn't have to be like that. So obviously we will go into further discussion regarding this, and we will also see how we can control our diabetes and do things which will either prevent us to be diabetic, and if we have diabetes, we can keep it as low as possible and try and control our blood sugar level. Now, type 2 diabetes is much more common than type 1 and tends to develop gradually as people get older, usually after the age of 40. But more and more people are linked closely with diabetes because either they are overweight, they are physically inactive, or they have a family history of diabetes. And it is much more common than in this country or in the Western world than the locals, because of much more common in ethnic groups like South Asian and African Caribbean. Now, Dr. Jason Fung asks us a question: Is diabetes chronic and progressive? Is it reversible? And he gives an answer to that, that it is not chronic and progressive. It is reversible and curable. However, people think that if they have drugs, that it can cure the diabetes. But Dr. Fung is of the opinion that drugs cannot cure a dietary disease, because if you control your diet, then your diabetes will be under control. And if you control your diet from an early age, the chances of you having diabetes are much less. And even if you have diabetes, if you control your diet, if you do exercise, if you control and manage your stress, if you are a relaxed person, if you are not overweight, if you are not smoking, then the chances of not having diabetes are much higher, like 80, 90, 95%. Depends on your age as well, because as you grow older, if somebody in your family has had diabetes, then you are likely to be diabetic, because one of the main causes of being diabetes is hereditary. Nobody has conclusive results that why a person has diabetic. So all these factors, I'll be throwing light on it as I go along, and you will see that how it can benefit a person. Now, diabetes, if you are diagnosed as a diabetic patient, like for example, if the doctor sends your blood for test and your HbA1c comes back and it's high, the doctor will say you are diabetic and will prescribe you a medication. However, in my opinion, if you're diagnosed diabetic at an early stage, it's better to avoid medication and go straight on a strict diet and exercise. Because once you start medication and you're not careful about your diet and you do not exercise, the doctor will only increase your medication, and the diabetes will get worse as time passes by. And if you are poor in exercises, if you do not take care of your diet, your diabetes, as I say, will get worse, and the doctor will prescribe you more medication and then more medication. I'm telling you this from my personal experience. I've been diabetic for the last approximately about 20 years. And obviously, if there is no awareness, if you do not know why you had diabetes, what you should do if you have diabetes, how you can control your blood sugar level, what sort of food you should eat, all these things if you're not aware, then your diabetes will not improve, and no doctor will tell you in detail as to what you should do to control your diabetes. Of course, they will tell you briefly, okay, do exercise, go for walking, control your blood sugar level, control your diet, and go and see diabetic nurse. The diabetic nurse will, of course, examine your feet and see that your feet are okay, in the sense that it has to be alert, and it has to be sensitive. There should not be any numbness. Similarly, you're sent for an eyes test, because diabetes is a disease, type 2 diabetes, even type 1, but type 2 more commonly, is a disease. If not controlled, it can affect other organs of your body, like it can affect your eyesight, it can affect your nerves. You can, if not controlled, you can have a heart attack, you can have a stroke, it can damage your kidneys. So you can see there's so many illnesses which you can be affected if your sugar level is not controlled. Therefore, it's so important to control your sugar level and change your diet from an early stage, especially if you have somebody diabetic, like your parents or grandparents in your family who is diabetic. Now, what are the signs and symptoms of diabetes? The signs and symptoms of diabetes are as follows. You'll feel thirsty, you'll be going to the toilet much more than an ordinary person to urinate. You'll feel very tired, and you might lose a lot of weight unexpectedly. Your vision might be blurred, and your cuts or wounds will heal slowly, and you might have genital itching or regular episodes of thrush. All these signs and symptoms, if you have, then please do not ignore it. Go and see a GP, get your blood tested, inform your GP that you have all this, and your GP will send your blood test, will take your blood test and send it to the laboratory. And there is a special blood test for diabetes which is called HbA1c, as I mentioned earlier. This gives you your sugar in your blood, called blood sugar level, HbA1c, which is an average of last 3 months. It's a very good test and will indicate whether you have diabetes or not, whether your sugar level is good, is bad, or is very good, so on and so forth. So that must be done if you have these symptoms. Now, how is it diagnosed? How one can tell that Mr. A, Mrs. B has diabetes? You take your blood sugar, glucose levels or sugar level, and prick your finger if you have got that instrument at home, and measure your blood sugar level. Otherwise, you go to the surgery, as I said, and have HbA1c done. The third check is that your GP can send you for a blood glucose tolerance test, which is another test which can indicate whether you are on the borderline or your high blood sugar level, or whether it's controlled or not. Now, how to reduce the risk of developing diabetes? One, you have to be more active, meaning you must do some sort of exercise. You must go for a walk. If you can do jogging, depending on what your age is, then jogging is very good. Otherwise, a regular walk once or twice a day is very, very good. If you can't do that, and if you're not diabetic, you're just trying to reduce the risk of developing diabetes, then you should walk at least 3-4 times a week. But people who have diabetes, they must walk at least once a day, or even if possible twice a day, and be more active. The more active you are, the better it is, because once you are active, you are burning your energy. You are using your sugar level which is in your blood. So your sugar level automatically comes down if you are active. Secondly, and most importantly, eat a healthy, balanced diet. Now I'll be expanding this, that what is a healthy, balanced diet, as we go along in the program. Give up smoking if you are smoking. Control your weight, because if you are overweight, it doesn't help. You have to lose weight in order to reduce your risk of developing diabetes. Be aware of the family history, especially if you have diabetes in your family, meaning your one parent or both parents or your grandparents or your uncle or elder brother or sister, then the chance of you having diabetes, as I said earlier, are much, much higher because of the loss. Control your stress. Be relaxed. This is also a factor which nobody tells you, but it's important that you don't lead a stressful life. If you're leading a stressful life, then again it will affect your sugar level. You have to be relaxed. The more relaxed you are, the more chances there are that your sugar level will be under control. Also, lastly, another important factor is you should have enough sleep. Now, different people can get away with sleep with different hours. You know, some people require 6 hours, other people require 8 hours. So anything which makes you feel comfortable and you're fresh in the morning, so you should take that amount of sleep. Maybe 6 hours, maybe 8 hours, maybe 7 hours, maybe 8.5 hours. But enough sleep is necessary. Now, how do you manage your type 2 diabetes? You control your blood glucose level, you control your blood pressure as well, you reduce your cholesterol level to reduce the risk of developing heart and circulatory diseases. Example, coronary heart disease, heart attack, and stroke. Now, as I said earlier, healthy lifestyle is very, very important. Now, the question is, what is a healthy lifestyle? Healthy lifestyle means your diet must be controlled. You exercise on a regular basis. You manage your stress level. You have enough sleep. Now, as far as exercise is concerned, you need to exercise regularly, because as I said earlier on, just diet alone will not reduce your sugar level, or those people who are not diabetic, their risk of developing diabetes will be increased if they have diabetes in the family. Also, it depends at what age you are, because once you are diagnosed diabetes, as I said, it will only get worse if you don't have lifestyle changes. So lifestyle changes are must. Exercise regularly, be active, walk regularly, and if you can't go out for walking, if the weather is bad, if it's raining, and those people feel that, you know, it's not good because it's raining, you should be active at home. You can do housework from, there's a number of housework you can do which will keep you active. You can do light exercises at home, only takes 15 minutes. You can do carpet cleaning, you can do vacuuming at home. Also, just walking up and down from the first floor. Don't be lazy. Don't ask other people to just do everything for you within the house, like the children or the wife, because that will make you inactive. Try and remember that, this is very important. And if you are not active, then you have increased chances of having diabetes, especially if you have diabetes in the family. Stop smoking and change your diet. Our usual diet, we are very tuned, we are very accustomed to having sugary food, like for example sweets, chocolates, mithai, gatia, chevra, so on and so forth. So if you want to reduce the risk, or if you have diabetes, and say for example if the doctor has prescribed medication, and if you have started medication, as I said earlier, you've got to change your lifestyle, exercise, change your diet. If you cannot change your diet, then with the passage of time, as time passes by, your diabetes will get worse. If you continue eating chocolates, mithai, gulab jamun, rasmalai, and all other Indian mithai, chocolates as well, and all those food which have high sugar and high carbohydrate, that will definitely increase your sugar level, and with the result that your HbA1c after a period of time will get worse. The doctor will prescribe you more medication, and once more medication is prescribed, you will still be used to the same lifestyle, not improving your eating habits, and then the medication will go on increasing. So this is no good, because medication, A, has its effects, every medication has its side effects, B, how much longer or how much more medication you can have. To me, when I wasn't aware of various steps to be taken, as I'm saying now, about 3 years ago, 4 years ago, although I was exercising, not on a regular basis, I was dieting, but there were certain things I wasn't careful, which I'll tell you in a moment. So my sugar level was up and down, up and down. And as a result of that, I was on almost a maximum medication. I was taking metformin, about 1,000, 2 tablets of 500 mg each in the morning, 2 tablets of 500 each in the evening. I was also prescribed a medication called gliclazide. I was having 160 mg, I think, in the morning, and 160 mg of gliclazide in the evening. Now this is the maximum gliclazide one can have. Maybe metformin I could have had more, but still it's a heavy dose of 1,000 mg of metformin and 160 mg of gliclazide. Why? Because I wasn't that strict with my diet. Secondly, I was also diabetic for a long period of life, meaning long period of time, meaning that I was diabetic for about 16, 17 years when I started taking it very, very seriously about 2 years ago. Not that my sugar level was totally out of control, it was within acceptable levels, within acceptable HbA1c. But I thought that such high dosage of medication is no good. Also, I was always very interested in walking, but I wasn't doing it on a regular basis, maybe twice a week, 3 times a week, sometimes a whole week would go away, and I would exercise only one day. So all these were contributory factors for the doctor to prescribe me high medication. I wasn't eating the stuff which I should eat. I was eating I was eating lots of chapatis, I was eating rice as well. Now, those people who are diabetic and whose sugar level is high and want to reduce their medication, so for them I would suggest that they should reduce their chapati intake and rice intake. Now I'm being asked to take a break at this stage, and I'll be back with you to discuss this important subject after the break. Thank you very much. Assalamu alaikum.